the importance of digitalization within the healthcare sector in emerging economies. Hello and welcome to another episode of Leading Health with myself, Dr. Attom. I'm so happy that you have been able to connect, to engage, and to explore this episode with me. Today, we are going to be exploring why and how digitalization is so important within emerging economies and what that means for the future of healthcare globally. So guys, good quality healthcare is really expensive, especially when we're thinking about it within emerging economies. So every year, millions of people cannot actually afford to get the good quality treatment that they need. And when we look on a global scale, every year there's so many people that are dying, that are being unnecessarily injured because of poor quality care. And that's where digitalization comes in. Digitalization within the healthcare context can be a tool that can actually move forward the health equality. And so health equality can be facilitated by advancing digitalization within the healthcare context. So what do we actually mean by healthcare digitalization? In essence, healthcare digitalization is our ability to leverage digital technologies to advance healthcare delivery, to move forward healthcare management, and also to advance healthcare administration. So let's think about the applicability of healthcare digitalization. On a global level, there's so many ways in which healthcare digital technology is being used in our day-to-day lives. Let's think about number one, telemedicine, and how that is actually having an impact. Let's think about digital diagnostics and how that's changing people's lives in terms of getting them better diagnosis really early. Let's think about healthcare information systems and healthcare information exchange and how we can now exchange healthcare information really quickly. We can also think about AI, artificial intelligence, and how that's shaping all sectors of the economy, especially healthcare. In addition to that, we can think about healthcare apps and wearables. I don't have any wearables, but a lot of people do. And you can see how healthcare apps and wearables are becoming an integral part of our day-to-day lives. In addition to that, we can think about electronic health record systems and how we can keep our patient records safer by having them electronically. And finally, we can think about health information management and how we manage healthcare information. So thinking about your large healthcare organization, your hospital, how you manage patient records, how you manage all of the systems and all of the filing within that organization. So we can start to see that when we're thinking about healthcare digitalization, its applicability within all types of healthcare organizations is actually massive. So guys, although we have all of these amazing benefits of healthcare digitalization, when we're thinking about emerging economies, there are some disadvantages, there are some limitations that we actually see. Number one, we can think about equity of access. So who actually gets access to these digital technologies? We need to actually try and level up on that. We can think about digital literacy and the impact that's having on the workforce and its capacity. So what I mean by that is, it's something I've seen in my own research. When I ask people, what are some of the barriers to more digitalization? They always talk about education and the need to actually upskill the workforce. We can also think about infrastructure and connectivity and the investment that is needed in infrastructure to actually really fully harness the power of digitalization within the healthcare ecosystem. We can also think about coordination, the health service and how we coordinate the different health services together, the public, the private, how we try to integrate things. Sometimes it's not that integrated. In addition to that, guys, we can think about sustainability and scaling up of digital initiatives. Sometimes we start a really small initiative, which is amazing, but then we can't scale it up or there's not enough funding. So we have to think about how we're developing technology that's sustainable within emerging economies. In addition to that, we can think about the repetition of clinical trials or of pilot studies. I see this a lot when I'm reading like research articles or trying to research something. You realize that, someone a few years ago, did a certain study, then the funding finished, somebody else repeated it, then the funding finished, somebody else. You know what? I think you get the message. We need to stop that. Another one of these points is about affordability. Now, a lot of these digital technologies are really expensive and not everyone has a smartphone. And sometimes you need a smartphone to be able to harness the full power of the technology that you're using. So that's something that we need to think about. And finally, standardizations. What we tend to find is that we have different systems in different hospitals. I remember when I was doing my research last year, going into a hospital, talking to the manager, and he was telling me about the problem they have with about 10 different systems that don't talk to each other. I was like, how do you manage? And the irony is they end up spending more time trying to get these systems to talk to each other than they would have just, writing this stuff down. So we need to have more standardization and more consistency. So before the pandemic, there was lots of research study done globally looking at which countries were most prepared for a pandemic. And unsurprisingly, countries in the Western world were deemed to be most prepared, and countries in emerging economies were deemed to be least prepared because of a lot of the issues that we've just talked about. But despite all of this, during the pandemic, emerging economies and countries within emerging economies did significantly better than was anticipated. They managed the pandemic more efficiently and more effectively than anyone could have predicted. So why was this? What was going on? Lots of factors actually contributed to emerging economies dealing with the pandemic better than anyone had anticipated. But we're going to focus on the role of digitalization, especially in healthcare. To do this, we have to take a few steps back. Way before the pandemic even struck, emerging economies were already embedding digitalization within their economies. So when the pandemic actually hit, a lot of emerging economies were already digitalized, far more so than Western economies. So when you think about, I don't know, mobile money, for example, not having to deal with physical money, that was already there. When you're thinking about the agricultural sector, when you're thinking about the educational sector, when you're thinking about, as we are, the healthcare sector, digitalization was already embedded within different elements of their economies. And so when the pandemic hit, they already had a really solid foundation on which to build. And I argue that's what really helped a lot of emerging economies not to suffer as much as had been predicted during the pandemic. So you might have guessed from my own experience and from all the research I've done that I'm quite biased towards more digitalization within the healthcare ecosystem, because I have already seen the benefits that it can have. When you're thinking about improved access to healthcare globally, but especially within emerging economies, that is going to be a massive game changer. If you're talking about disease surveillance and actually our ability to monitor outbreaks across the world and to get real world timings in terms of what is going on and to act efficiently. Again, we saw the benefits of that during the pandemic and other outbreaks, and I think digitalization is only going to advance that further. If we're also thinking about personalized healthcare, I think that's the new frontier, and one which actually is going to mean that you as an individual is going to have your healthcare dealt with as a unique being, not a one-size-fits-all approach that we sometimes see. That is gone. Healthcare education is another really important element, and I think that if we're able to harness the power of digitalization in terms of improving healthcare education, that's going to be really, really big. For example, I'm communicating to you through digital technology. Also, really importantly, economic growth. If we have a healthcare ecosystem which is embedding the latest technology within it, this is going to be a massive important breeding ground for new innovation, for entrepreneurship, for new jobs. And so we shouldn't think about healthcare digitalization as something that costs money. We should think about it as something that can bring in money, something that can generate jobs and actually generate high skilled jobs of the future, which is what we all want. So innovation and employment are really embedded within our future when we think about healthcare digitalization. So I would encourage everyone, wherever you are, to incorporate more digitalization within their healthcare ecosystem. Okay, guys, thank you very much for connecting, for engaging, and for exploring this episode of Leading Health with myself. Always a pleasure. Please subscribe. Please leave a comment. Please do the like button. Tell me what you want me to talk about next. I have so many ideas about videos that I want to make, but give me your opinions. Share your ideas. I'm always looking out for new ways of communicating with you guys, for engaging with you guys. So let me have it. Let's connect. Let's interconnect, and let's explore healthcare together. See you in the next episode. Thank you very much.